Traditional Indian practices like yoga and Ayurveda strongly focus on mental and physical well-being, and they are deeply rooted in the concept of preventive healthcare. Ayurvedic medicines and treatments are very popular and easily available in India. But why a modern, developed nation like America is showing interest in this ancient Indian medical practice? In Washington, D.C., Dr. Narayanan has something important to share regarding this.
The medical system that we have today is no longer about public service. It is all about a very big business model. Now, the roots of it goes back to the health insurance systems that came along, private health insurance systems that came along, where to run the business, they are thinking in terms of how effectively what is billable through the health insurance. So when they take that approach, the doctor is really a businessman rather than a healthcare provider. First a businessman and secondarily a healthcare provider. Okay? So when that has happened and yoga is not covered by most health insurances, practically it is not viable. However, there is a small percentage of doctors who have, and these are particularly doctors who have been practicing for many years and people who are in the older age group, in the 60 plus, who after looking through what modern medicine system has done to people, the good as well as the bad, and the place where it really is not that good is in chronic conditions. Modern medicine is very good for acute conditions. You have a heart attack, you have an accident, modern medicine is the best for you. Whereas on the other hand, if you are in a chronic illness like diabetes or heart-related weakness or whatever, staying in drugs for many, many years, one drug after a period of time leads to another and other complications come and they go on. So there is no cure from a modern medicine perspective. Whereas our traditional medicine and yoga approach can give cure to them. So there is appreciation among a small set of physicians, and these set of physicians, they choose to work outside the health insurance system. And so they are the people who will be willing to take it forward. So we work with some of these physicians who are like that. And there are some who also work in the mainstream medical, but they will give it as a counseling to their patient. You may want to go and talk to somebody and make use of yoga, but themselves they don't treat with yoga. So our scientific base is the 8,000 plus journal articles, and we have the accreditation accepted by the American medical community, whereby we are able to give them medical credits.
Rising healthcare costs is now a major concern in many developed nations. In the UK, experts think that obesity may even bankrupt the National Health Service. According to a report by OECD, mental illness costs UK £94 billion a year, and in America, mental disorders is the costliest medical condition in the country. If diseases can be prevented or detected early, public health goals can be reached faster. It is quite reasonable to say that preventive healthcare is the way forward. There are enough examples which show that spending more money on health does not always guarantee better health. According to AAPI, healthcare in America is more expensive than in any other wealthy nation. In 2016, the average American spent $4,571 on their health, a figure 5 times higher than the average out-of-pocket spending of other countries in OECD with no measurable better health. The life expectancy of the average US citizen is 78.8 years, just a fraction ahead of the Czech Republic, where the spending was $236 last year. Bloomberg Health Efficiency Index is based on the efficiency of healthcare system in the countries as it tracks medical costs and value. For any country which does not want to blindly copy the public health spending of developed nations, the ranking of countries in Bloomberg Health Efficiency Index can be an absolute eye-opener. Though America had one of the highest per capita spending on healthcare, the life expectancy of Americans, which is about 79 years, was exceeded by more than 25 countries and territories. The healthcare system should be rooted in the spirit of Indian concept of seva, not business. Needless and commission-driven diagnostic studies, surgeries and interventions can be avoided if the medical service providers are properly trained and have genuine intentions. Globally, providing effective healthcare continues to be an ongoing challenge. In a survey that was conducted in 2015, 26% of Americans said that someone in their household is struggling to pay medical debt. In 2017, 10.9 million people in the USA were pushed below the poverty line because of out-of-pocket medical costs. Nearly 80% of US workers live paycheck to paycheck in order to make ends meet. It was also revealed that 46% of Americans could not even cover a $400 emergency expense. They would have to cover it by selling something or by borrowing money. Even those Americans who have health insurance often find it difficult to pay the amount that is required before the insurance plan starts to pay. It was found that half of all insurance policyholders in the USA faced a deductible of at least $1,000. An amount of $1,000 is already too much for many Americans to have in their bank savings. In 2016, a survey by GoBanking Rates revealed that 34% of Americans have no money in the bank and 69% of Americans do not even have $1,000 in savings. This means that they will be unable to pay a $1,000 health insurance deductible in the event of an emergency. The ongoing struggle of the healthcare systems of many developed nations clearly indicates that India needs to create its own unique model to achieve good results in healthcare. In addition, the Bloomberg Health Efficiency Index also indicates that a high per capita spending on healthcare does not guarantee a better life expectancy. As I mentioned earlier, healthcare system should be rooted in the spirit of Indian concept of seva, not business. By combining the goodness of Ayurveda, yoga and the modern medicine, and by creating an ecosystem around the traditional Indian concept of preventive healthcare, we should be able to do better in safeguarding our future. See you again.